You have what? You have function?
No, it's that pouring of the water function. I know.
Great.
Good morning, everyone.
Good morning.
Secretary Temby, please call the roll.
Here.
Here. Here. Here.
Here. Thank you, Judy. Have we checked to see if Gerard's on the phone yet? He hasn't called in. We'll wait for him to call in, and we'll just go on. The first item of business is the report by the University of Wisconsin School of Medicine and Public Health on its activities in Milwaukee, and I have requested that Vice President Regent Mark Bradley chair this session.
Good morning. Before I introduce Dean Robert Golden from the School of Medicine and Public Health, I thought it would be helpful for not only the members of the board, but our statewide audience to review the background for the report that we're going to hear from the Dean. We're dealing with three principal issues, all of which are very important. As for the first issue, many of us were here last November when the Board of Regents approved the renaming of the UW Medical School to be the UW School of Medicine and Public Health. As part of our discussion surrounding the renaming of the school, we asked the school to engage in what we called good faith dialogues with the UW of Milwaukee and with the City of Milwaukee to develop strategies addressing this important public health challenges to Milwaukee. We also directed the school to provide us with an annual report on its collaboration with UW Milwaukee and the city in addressing public health issues. The Regents received that report in their materials, and we'll hear a summary of it from Dean Golden today. Now for the second issue. Last June, the Board of Regents asked the School of Medicine and Public Health to report on the medical education provided to students at the Milwaukee Clinical Campus through its affiliation agreement with Aurora Healthcare. In particular, we asked that upon assuming the position of Dean of the School of Medicine and Public Health, that Dr. Golden give prompt and careful attention to the question of how best to address the need for continuing physician and medical student involvement with the diverse populations found in the Milwaukee Central City as part of that affiliation agreement. Dr. Golden will provide us today with his assessment. Your folders include a written statement from the Dean. I just want to remind you that we're receiving that report. It doesn't require any action today. Now for the third issue. We're not going to hear a report on the third issue today, but just to get you ready, we're going to hear a report on the third issue next month. So in December, we're going to receive a report on the planning efforts that have been ongoing among the UW system, UW Milwaukee, and also the City of Milwaukee, as directed by the three principals, President Riley on behalf of UW system, Chancellor Santiago on behalf of UW Milwaukee, and Mayor Tom Barrett on behalf of the City of Milwaukee. That planning process has been assessing health-related initiatives at UW Milwaukee and options by which the university might address even more effectively the health needs in the Milwaukee region. So as you can see, we have a lot of things going on in southeastern Wisconsin, particularly the Milwaukee area, with public health care issues and health care delivery. And at the center of it all is the statewide public institution, public medical school, and its new dean. Dr. Golden became the 9th dean of that school last July, and I think it's safe to say that he's had to hit the ground running. Dr. Golden came to Wisconsin from North Carolina, where he served as the Vice Dean of the University of North Carolina School of Medicine. He also served as former chair of its Department of Psychiatry. In his more than 20 years at the University of North Carolina, which is a flagship public university, just like our Madison campus, Dean Golden held the Stuart Bondurant Distinguished Professorship. He also proved himself a highly effective leader in academic medicine, and as Vice Dean, he played a key role in running the school and launching several creative new programs. As chair of psychiatry for a decade, he guided the expansion of the department's research, clinical operations, training programs, and development. So please join me in giving a warm welcome to Dean Robert Golden.
Thank you very much. Let me start out first by saying what an incredible honor it is to be in this new role of Dean of the School of Medicine and Public Health. And I also want to start out by thanking you for the opportunity to give you an update on two separate but, in my mind, very interrelated issues. Before I do, I recognize that I have not had a chance to meet most of you before today. And I thought it might be helpful, I hope it will be helpful, if I indulge in a little bit of personal background, because I think it provides a context for the issues that we're going to be talking about today. I went to medical school at an institution that kind of was a tale of two cities. There were literally two teaching hospitals across the street from each other. One of them was established to serve the underserved in Boston, Boston City Hospital. The other, right across the street, was a university hospital that served a very different kind of clientele. The medical students, the house staff, many of the faculty walked back and forth across these two institutions. And while the quality of care was outstanding in both, there were some unacceptable differences in terms of access to care among the poor and underserved in Boston City, the resources that were brought to bear to serve their needs, and even some of the attitudes and interactions between professional staff and those patients compared to their more fortunate counterparts at University Hospital. That experience had a transforming effect. I made a commitment then and there that I was only going to work in public institutions. I decided at that point that the main focus of my work was going to be breaking down those differences by elevating the one while maintaining the other. And ended up going down the road of administration because I realized the opportunities to achieve those goals would be greater serving as an administrator as opposed to serving as a real faculty member the way my wife does. And so these issues that we're talking about today are woven into my genome. The genome had very early expression because at the birth of my academic career and ever since then, I have only served in public institutions like the wonderful one that I have the pleasure of serving in now. So with that as a background, I want to give two separate reports. The first is a overview of our collaborations in Milwaukee, collaborations that involve both the Wisconsin Partnership Program, as well as other resources that are being wisely invested by the School of Medicine and Public Health, separate from the Wisconsin Partnership Program. Excuse me. In both instances, we are working with wonderful partners in the city of Milwaukee. And in describing for you first the Wisconsin Partnership Program collaborations, I'm going to touch base on a number of these collaborations, which include a growing number of community health providers and health organizations, also the City of Milwaukee Health Department, several Milwaukee research sites which we have established, our partners at the University of Milwaukee campus, the Center for Urban and Population Health, as well as the other medical school in Wisconsin, the Medical College of Wisconsin. To date, the Wisconsin Partnership Program has invested a total of 7 grants to various community health organizations for a total of approximately $1.4 million. These are in the form of grants ranging from fairly small ones, $25K, to more substantive ones approaching $500,000. All of these grants with our community-based programs address important public health needs and are all geared towards eliminating health care disparities. Let me touch base briefly on just a few exciting representative projects. One of them is aimed at improving birth outcomes in African American populations in inner city Milwaukee. Another is providing social support as well as case management for women at risk for partner violence, a horrible epidemic throughout urban the United States. Another is working collaboratively with others to promote healthy and safe neighborhoods. These are, I think, wonderful examples of what the Wisconsin Partnership Program is all about. The next cycle of grants will be awarded in December of this year, and so far over 20 Milwaukee organizations have applied for the next round of funding. We have also had wonderful opportunities to partner with the City of Milwaukee Health Department. This partnership so far has involved an investment of over $1 million. One of the biggest issues facing healthcare delivery and public health involves the workforce. And we are working collaboratively with the Milwaukee Health Department to set up a flagship educational training site that will generate the next generation of public health workers, most of whom we hope will stay in Milwaukee. So we have a population health fellowship program, which is outstanding. One of the first graduates was recently hired by the Milwaukee Health Department. So the plan is working. We also have a new MPH program, and several of our students just completed their field placements there this summer, and by all reports, it was a wild success. In all of these placements, our trainees and their supervisors are addressing critical public health issues, including serving the needs of African Americans with cancer, a very high priority, as well as a citywide effort to create a comprehensive HIV/AIDS service plan. We have also invested in supporting an on-site educational coordinator to make sure that these training programs are as effective as possible. We are also working together, and Bevan Baker, who I've had the pleasure of meeting with twice so far, has endorsed this as a wonderful partnership. We are also investing in Milwaukee research sites with several exciting projects that are part of the Wisconsin Partnership Program. The survey of the health of Wisconsin is fantastic. When I was in Boston, there was a lot of excitement about the Framingham study, which was one of the first prospective epidemiologic studies that really revolutionized our appreciation of public health needs. SHOW is like Framingham on steroids. It is a huge study that is going to follow 10,000 people prospectively, and one of the major sites is right there in Milwaukee. Also, we have established the Wisconsin Health Research Network, a coordinated network of statewide healthcare organizations that together will do important clinical and translational research, much of it focused on health disparities, health status, and access to care. The Milwaukee Research Site is receiving about $500,000 a year as a key site in each of these important initiatives. We're also working together with our other sister organization, UW Milwaukee. We are providing salary support for new faculty hires there who will be affiliated with the Center for Urban and Population Health. We have also established a regional partnership network with UW Milwaukee and with CUF in order to reduce disparities in cancer care. And you see the extent of our commitment to that program. The Center for Urban and Population Health is a remarkable program. It has a special initiative to address the health of Milwaukee public school children, working collaboratively with the Milwaukee school system to remove health-related barriers to learning. Also, there is a wonderful collaborative effort of the Center for Urban Population Health together with UW Milwaukee and Milwaukee Public Schools in this and some other things that are in planning, and you can see the extent of our commitment there. We have also partnered with the Medical College of Wisconsin, look forward to doing more things together. One partnership to date has been the Healthy Wisconsin Leadership Institute. This is a statewide public health leadership training program jointly sponsored, and it has created 5 community teams. One of them is in Milwaukee, and that team is addressing the important challenge of reducing risky sexual behavior among Milwaukee's adolescents. Now, in addition to the important collaborations and partnerships through the Wisconsin Partnership Program. There are other similar programs that predate the Wisconsin Partnership Program and that continue to grow that involve other resources from the School of Medicine and Public Health that are being invested in Milwaukee. And I want to touch base on these as well. We are doing some very important work with one of the most impressive organizations I've seen. Even prior to arriving here officially, I had the great privilege of touring the United Community Center, which is one of the most impressive community-based organizations I've ever seen. The fellow who directs it is one of my heroes. And when I'm done doing the dean thing, I'd like to get a job working with him there. This is a comprehensive human service organization serving the Hispanic community in Milwaukee. We are working as partners with them in supporting the development of both clinical and clinical research programs, looking at Alzheimer's disease in that population, and educating physicians on the early diagnosis and treatment of Alzheimer's disease as it presents in the Hispanic population. We have also given $50,000 of our school's resources to our sister campus, UW-Milwaukee, to support the feasibility study that you'll be hearing about at next month's meeting. As it turns out, one of the 3 consultants brought in was from UNC Chapel Hill, and word got back to my friends at Chapel Hill that our school was giving their school $50,000 to study the development of another school of public health. And one friend made the comment, let me get this right, this is sort of like UNC Chapel Hill giving a bunch of money to NC State to study the development of a basketball team. But I don't see it that way. I don't see this as competition. I see this as a wonderful opportunity to develop additional resources in public health. We are also working with the Milwaukee Clinical Campus. I'll have much more to say about that in just a few moments. This is an essential element of our school's commitment to making sure that our students get outstanding learning experiences in serving the underserved, in particular the minority inner city populations of Milwaukee. And this has been guided by the recently implemented affiliation that was completed prior to my arrival between the university and Aurora, reaffirming the commitment. And I personally feel that it is a wonderful foundation for working together with Aurora to make sure that our students get the outstanding training experiences that they deserve. We are also working together with the Center for Urban and Population Health in ways that go beyond the Wisconsin Partnership Program. This CUF, the center, is a partnership involving us, UW-Milwaukee, but also Aurora Healthcare stepped up to the plate providing resources for the center. And the center focuses on improving the health of urban communities through health services research, education and training, and health promotion. One of the true jewels in the crown, one of the many jewels in the crown of our school is the UW Center for Tobacco Research and Intervention. Around the country, this is viewed as the very top program in this vital area. It has now established very active outreach, clinical, and research programs in inner city Milwaukee, aimed specifically on the underserved minority populations. And that center invests about $2 million a year specifically in Milwaukee for outstanding programs. I just met with the very dynamic leader of that organization, Mike Fioria, just a few days ago, and his latest project is brilliant. He is going to try to get some of the toughest populations to stop smoking, and that includes parents of young kids, by getting to them when they bring their kids in to public clinics with ear infections, with sore throats, to not tell them about the need that they've heard before to stop smoking for their sake, but to emphasize the need for them to stop smoking for their kids' sake. And the program will be provided for them in a way that already has had dramatic success in other sites. The newest program is the Institute for Clinical and Translational Research. I hope you'll hear a lot more about this down the road. We are involved in a nationwide intense competition to receive support from the NIH for a new Institute of Clinical and Translational Research. Even before we submit our application, we are investing in infrastructure in Milwaukee to be able to dramatically expand clinical and translational and population-based research in a way that we believe will be leveraged into substantial new support from the federal government through the NIH. So this is a summary of the investments, the collaborations in Milwaukee through the Wisconsin Partnership Program to date. A summary and a kind of spreadsheet, I guess, of what I just summarized. You can see the bottom line is fairly substantial. And this is a summary of the other investments from other sources within the Dean's Office of the School of Medicine and Public Health, specifically targeting Milwaukee programs. I think what's much more important than the bottom line, what's much more important than the dollars, are the actual programs and the synergies that will come about because of this. And I think, though, this is a reflection, this is, I think, a documentation of us putting our money where our mouth is when we say that Milwaukee is vital to the vision that we now have of what this School of Medicine and Public Health is all about. Now, what I'd like to do next is, and this is the bottom line summary, what I'd like to do next is to give you a report. You have my formal statement in front of you, to give you my report on my initial observations, my initial thoughts, my initial plans for the Milwaukee Clinical Campus, and specifically for the training of the next generation of our students. Training that must include top quality experiences in working with the underserved and the minority populations of inner city Milwaukee. I think it is really fair to say that no issue has received more of my time and attention, appropriately so, than this one, since my arrival here on July 1st. And my approach has been to listen and learn. And I've learned a lot. There is still much more listening and learning that I need to do. But with the proviso that this is a plan in evolution, I want to share with you the background and the current thinking about how we're going to move forward. The background is that I have met with many, not all, but many of the key stakeholders in Milwaukee. I, as I mentioned, had the privilege of starting out with a tour of the United Community Center and with Ricardo Diaz, the outstanding director there. I've been through other clinics, including free clinics, clinics serving the underserved, Walker's Point Free Clinic, as well as the inpatient and outpatient and emergency services at Aurora Sinai Medical Center. I've met with multiple community leaders, including the Commissioner of Health, the directors of several of the federally funded community health centers, and other public and community health organizations. I've met with the Milwaukee faculty, including some of the minority who were quite upset about some of the administrative changes that took place prior to my arrival. I think most importantly, I've met with medical students. I always find them to be the most valuable source of information and, quite frankly, the most important constituency that I serve. I've met with them collectively in groups as well as individually in Milwaukee and in Madison. I've attended an executive committee meeting of the Center for Urban Population Health, met with Mike Dunn, my counterpart at Medical College of Wisconsin, now on 3 occasions, and with the new leadership of Aurora, including the CEO, Nick Turkle, who is a former member of our Milwaukee faculty, a family practice doctor with all the right values and vision. I have scheduled meetings which will take place in the next couple of weeks with Mayor Tom Barrett and also with Chancellor Santiago. And I view all of this as the beginning of an ongoing partnership, an ongoing process of working with our partners in Milwaukee. As I have listened and as I have learned, I've become aware that there are some very substantive issues and aspects of our school's relationship with Milwaukee which need considerable attention and considerable support beyond what has already been committed. Many resources are already in place to provide effective training, but there are, quite frankly, some areas that I'm concerned about and that need to be carefully monitored and addressed. When I met with our medical students, I learned that the majority have requested clinical rotations in Milwaukee mainly because of their desire to work with patients from underserved and minority populations. However, the transition of the Milwaukee faculty into the UW Aurora practice group resulted in the turnover in a few key faculty positions in Aurora Sinai. Those positions have now been filled by new leaders who I'm very impressed with. And the students based in Milwaukee were exposed to some of the considerable unrest among the few departing faculty. This resulted in some instances, I'm afraid, in inadequate attention to the interests and the training needs of our students. Many of the students are incredibly excited and stimulated by the Milwaukee learning environment and eager for the school to formally rededicate itself to these educational opportunities, and we have. In recent months, I was distressed to learn that while the majority of our students had clinical experiences in the Milwaukee area with the underserved population, several did not receive the opportunity to work with this group. In my discussions with Milwaukee community leaders who were not shy in expressing their opinions and their wishes and their concerns, all of them expressed profound concern about the health of Milwaukee residents and urged our school to play a significant and expanded role in solving the long-standing problems of lack of appropriate access to health care, as well as several interrelated social and economic issues. All of the expressed concerns merit careful consideration and a very thoughtful response. In the area of medical student education, prior to my arrival, the school undertook a far-reaching assessment of our medical student learning experiences with the underserved. Engaging faculty from all over the state, an ad hoc task force really cataloged a wide menu of learning opportunities with the underserved. They also made specific recommendations on how to enrich and expand this portfolio. I am pleased to report that as of just a few weeks ago, I think it was, our formal review process within the school, the Academic Planning Council, has endorsed all of these recommendations, and we are now pushing forward full steam with implementation. Even prior to that approval process, as soon as I learned about the issues involving our medical students in Milwaukee, I immediately contacted the responsible parties and told them that they must now fix it, and that I am expecting close monitoring of our students' learning experiences in the Milwaukee Clinical Campus, and I insist that we ensure that all of our students receive high-quality education on the healthcare needs of the underserved. And I am confident with the response to date to my directive. So let me share with you several conclusions. The list I expect will grow over the next several months, but based on what I have learned to date. First, I believe that our new 7-year affiliation agreement with Aurora provides a very good, solid foundation on which to build and monitor our ongoing relationship with Milwaukee and to remain engaged with the underserved populations. The fact is, Aurora is now the primary provider for Milwaukee's most at-risk populations. I believe they are the only healthcare system that has maintained an open hospital in the most disadvantaged sections of that city. Aurora has made a public commitment to maintain Mount Sinai Medical Center. Having toured that facility, it is clear that they have invested in it. It's a spectacular physical plant, and it is clear that Aurora has invested substantial resources in that important facility. Number two, the problems of poor health status and inadequate access to health care in Milwaukee are long-standing and deep-rooted. The solutions will not be simple. The so-called safety net has gaping holes, and far too many people are falling through that holes, especially as other hospitals close, leaving Aurora Sinai as the primary inpatient resource for inner-city Milwaukee. Number three, Aurora's decision to trim its network of clinics in central Milwaukee and the transition to an Aurora employment model for teaching physicians at their facilities does create the potential to reduce the number of learning opportunities with the underserved for our students. This cannot happen. Our students must have access to these opportunities, and we have now taken steps to ensure that this occurs. We have also begun the process of exploring, discussing, and negotiating additional potential new training opportunities in community-based healthcare centers outside of the Aurora system in an effort to complement the access available within the Aurora system and to expand our teaching base. Number four, the new medical group established by the School of Medicine and Public Health and Aurora Healthcare has a very solid foundation. It is now fully staffed with physicians. Replacements have been made for the departing faculty, and there is a very good, very thoughtful governance process in place that includes strong university input. Number 5, under the terms of this 7-year affiliation agreement, the school will continue to place as many students as possible in Milwaukee. This year, approximately 150 of our students will learn obstetrics and gynecology, primary care, and internal medicine in Milwaukee, primarily in underserved settings. Nearly 2/3 of our students will learn some aspect of clinical medicine in Milwaukee at some point in their medical school career. Number 6, in my opinion, the education of our students will not be complete unless they become aware of the unique healthcare risks experienced by urban populations, especially those that are disadvantaged. They must learn this from physician role models who practice in these environments. One of our most important contributions to improving healthcare in Milwaukee will be the continuous production of physicians and public health workers who practice in these underserved areas. And history and well-done studies have shown that students who choose to train in these clinical settings and who get top quality training and supervision are the very ones who will then select to serve in those settings when they're done with their training. Number 7, we fully support the Milwaukee Healthcare Partnership, recently formed by the city's 5 healthcare systems in an effort to bring more physicians to the central city. Number 8, enhancing the school's relationship with Milwaukee and monitoring our students' educational experiences is one of the very top priorities of my deanship. I want to make that really clear. Recently, I initiated a planning process for several exciting potential new collaborations with Milwaukee, all designed to address the unacceptable problems of healthcare access. For example, one of the fantastic programs here that I heard about when I was in North Carolina, people spoke about it with awe, is WARM, the Wisconsin Academy for Rural Medicine, a very thoughtful approach to bringing in and developing a cohort of students who are going to work with the underserved in rural Wisconsin. In a similar way, in a very preliminary way, we are beginning to plan for another parallel track that will prepare students for careers of service and leadership in inner city Wisconsin. And we are very excited with pushing that forward as quickly as we can. Finally, it is clear that this must be an ongoing process, an ongoing dialogue with all of our partners and all of our constituents in Milwaukee. We will continue to work towards the creation of the best possible collaborations. But at the same time, people must have realistic expectations. The School of Medicine and Public Health cannot solve all the economic and social and all of the healthcare access problems that are in Milwaukee. You have my word that we are fully committed to doing all that we can and to work with all available partners. And I'm absolutely convinced, it's the reason why I'm here before you, it's the reason why I'm here in Madison. I am convinced that this school can have a transforming effect in the health and the healthcare needs of Milwaukee. But I want to be straight with you. It's not going to happen with us alone, and it's not going to happen overnight. So thank you very much for the opportunity to be with you today. I would be happy if the protocol allows it to entertain any questions or comments from the board.
Yes, thank you very much, Dean Golden. We'll take questions. Regent Salas?
Yes, thank you very much, Vice President Bradley. Dean, you noted in your statement at the bottom of the page that medical students continue to designate Milwaukee as one of the areas in the clinics for their practice, and you're really excited about that. And you also noted in page number 2 the number of medical students that want to go to Milwaukee. We're very excited about that. But you also note at the bottom of that page the unrest among some of the departing faculty. I wanted to ask you 2 questions. One, in regards to how many have left, and how many have stayed, and are there still legal issues pending on their departure? Secondly, in your conclusion number 3, you know that Aurora has proceeded to trim its clinics in the central city. I am from the south side, a member of the 16th Street Clinic, My mother is a member of the Johnson Clinic. As you're aware, the 16th Street Clinic can no longer take in any additional patients. We're just overloaded. There are plans to do some expansion, but one of the primary clinics in the area is completely overburdened. Secondly, the Johnson Clinic has closed down. And I just wondered what plans or what can be done by the medical school to not only locate medical students there, but to see if there's any possibility of expanding services in those areas that are going to be trimmed by Holo. Thank you.
For your first question, I'm not able to provide specific, accurate statistics, but I'm hoping that Gordon Ridley, our Senior Associate Dean for Administration, can. Gordon, can you address those?
Yes, approximately 10 of our faculty left employment, approximately 30 remain, and of those both who left and remaining, 7 have active academic staff appeals with the university that haven't been heard yet.
And in regards to the trimming of the clinics in Central City, there was that section
Yeah.
what can the School of Medicine do to provide a we know that medical students want to go and practice there, but if we're closing clinics, the issue is more than just we're going to locate the medical students. The issue is can we expand services where the laboratories are recruiting them?
Well, of course, as you know, Aurora is a separate corporate entity. The school, the university, the state system cannot control the corporate decisions made by Aurora. What we can do, and what we intend to do, is to use our affiliate agreement as a holy pulpit to encourage them to do as much as possible to maintain services for the underserved. As someone who is making the transition from an outsider to, I hope, an insider in this wonderful state, I do have to say, coming into it, that in my assessment, my personal assessment, Aurora is stepping up to the plate in a way that I would hope all corporate healthcare systems would. And I see the cup as being more than half filled rather than partially empty. I acknowledge at the same time, though, that it is extremely painful for the citizens of inner city Milwaukee to see programs shut down. To be very straight with you about what the school can and can't do, we can't set up our own clinics in inner city Milwaukee. That is not within the purview of what the UW School of Medicine and Public Health can do. What we must do is ensure that all of our students have training experiences, and that is why we are now talking not only with Aurora to encourage them to maintain capacity as much as we can convince them to maintain capacity. We are also discussing with other community-based providers, including the federally funded community clinics. We're discussing with them, investing some resources with them to see if they can make up the difference. Our primary responsibility is really to our students. We cannot fill in the gaps in the healthcare system in Milwaukee, but we are prepared, as you have seen, to bring in more resources that together with the health department and with other Milwaukee-based organizations can bring added value to their responsibilities.
Regent Davis.
Good morning and welcome.
Thank you.
I am virtually a lifelong resident of Milwaukee. You probably knew that already, but I just love saying it. And I agree with you that what we are most responsible for is the fulfillment of the enthusiasm of the students to gain an experience that then also helps Milwaukee in addressing its healthcare needs. I think that is just absolutely right on. And I think the question that I have for you is how can we help you? Because I think that based on your presentation and conversations with others, clearly the number of student opportunities for experiencing public health experiences, especially at the clinical level, has been reduced. I don't think there's any disagreement that that has happened. And I think that we would all agree that that is not a trend that bodes well from an education standpoint, let alone a healthy Milwaukee standpoint. And I applaud you for having a commitment to turning that around, whether it's through with Aurora or outside of Aurora. I wanted you to know that I think that we are 150% behind you, but I also would like to know if you have a comment on how we can help you in that endeavor. I mean, because it seems to me you probably need some help. And we have been struggling, some of us anyway, and struggling with, well, what is our role? What can we do to push that, to turn that trend that we've all been proud of over the years back to where it needs to be in Milwaukee? So I'll shut up at that point and ask you, what can we do to help?
Well, thank you very much for the invitation to help. There are at least two ways in which you can help. The most important one is to continue to do the important good work that you do day in and day out as a Regent, to continue to be an effective advocate during the years forward for the state system and our university and hence our school, to continue to get the resources that we need. I know there are tough choices facing the government during the current economic climate in Wisconsin. I truly believe that the return on investment in education in general and healthcare and public health education in particular is spectacular. And the most important thing you can do is to continue to do what you are doing day in and day out by being our advocate and our guardian of the critical resources that we need to do the work of the university and the work of the school. The second assignment is perhaps targeted more towards some of you on the board rather than all of you. And that is to please be a source of advice and counsel and suggestion for me. There are many voices speaking to me from Milwaukee. Sometimes they are shouting rather than speaking.
Yeah.
Some of them, understandably, in a way that I respect, have their own particular perspective and agenda. I would welcome input from each of you, especially those of you who know Milwaukee, who live in Milwaukee, because it will add a kind of balance and perspective that will help the other sources of information become integrated and synthesized in a way that is comprehensive and not biased. I try my best to avoid paying disproportionate attention to the squeakiest wheels. Some of the squeakiest wheels have the most important insights and ideas, but it would be useful in my sifting and winnowing process if you could give me your perspectives and your input in whatever way works for you. Email, phone, carrier pigeon. I want to hear from you.
Thank you. We'll do that.
Thank you.
Any other questions, Regent Burmester?
I just want to emphasize how pleased I am and how important the initiative we have in Milwaukee Public Schools in reducing the barriers to learning through the health issues. And just encourage you in other opportunities, because health issues are one of the major barriers to health. The example you gave of the Mining Community Center and the Carter Field is, I agree with you, that it's a lot of learning. It is a perfect example of all the aspects, and what they're doing in the best is a very good model that should be replicated for issues. The other thing to point out is just where schools in Milwaukee have a shortage of school nurses. It's a huge issue. There are many, I don't want to say most, but maybe these schools do not have a school nurse. There are a couple of initiatives trying to get more school nurses, but it's very busy. So anything that you can do continuing down that line, I think.
Those are excellent points, and in fact, now that you mention it, I will be sure to share that observation with Catherine May, who is the Dean of our School of Nursing. She and I, along with the other health affairs deans, meet on a regular basis and are building a real collaborative approach to health affairs and health sciences. I don't know. I don't know if I'm not aware of any activity going on, but I will find out from Catherine and encourage partnering. We are partnering with the initiative that I mentioned, the Clinical and Translational Science, which is a research collaboration, but it's a clinical and translational research collaboration that is at the bedside and in the community. And through that, there is plenty of opportunities to bring nursing in because they are partnering with us. But more specifically for the school nurse need and for the training opportunities there, I will make sure that at my very next meeting with Catherine, I bring that up.
Procedural question regarding the School of Medicine Public Health. You point out in your remarks that it is most important that students learn from physicians as role models who practice in the environment that we're talking about. Many of your students learn medicine at least one of their rotations in Milwaukee. What does the school require of students? Is this a voluntary selection that students can go to Milwaukee for rotation, or do they have a selection of rotations that are similar to this?
Well, I'm going to let another senior associate dean, Sue Skochalak, comment on that. But let me say that what we are moving towards is potentially creating a track for those students who want to spend most of their time in Milwaukee. They will not spend all of their time in Milwaukee in that track because there are certain sub-specialty kinds of experiences that they really can't get in Milwaukee currently. But I'm going to ask Sue to comment on the way our students get assigned.
Thank you. Our students, at the time of admission, know that they're required to spend at a minimum 16 weeks, 4 months, around the state in different rotations. We feel that's part of our statewide campus responsibility. We also think it's to the benefit of their training that they are in different environments. So in addition to Milwaukee, we have affiliate campuses up at Marshfield and in La Crosse. Students do rotations based on their choices, so they may choose to go to Milwaukee, they may choose to go to the other campuses. Right now, we don't require all students to go to Milwaukee. The capacity hasn't been there for them to handle every student, but we encourage them, and we find that at least 2/3 of our students have the opportunity. The training sites that we have, actually, I wanted to be sure the information is accurate, and I double-checked through 2 different sources. The numbers of students that are working in underserved training sites 2 years ago, 96%, now 88%. So clearly there's a decrease, but we're at 88% and looking to bring it back up. Dean Golden has indicated he wants it to be 100%, and I really agree with that. I think also the task force of the underserved learning experiences that he mentioned will be very important for our school to take us to the next level. One of the reasons we have moved into other sites is it was too crowded in some of the situations in Milwaukee, and I don't think it serves patients or students well if they're not carefully coached and mentored when they're in a learning experience that is unfamiliar to them. Sometimes that just reinforces stereotypes and biases. So again, I think the school has the opportunity to be more thoughtful in the way in which we teach our students and have them learn from role models that work with underserved.
Any other questions? Regent Walsh?
Dean Golden, we understand that the issue with Aurora, but historically, I would assume there were other sources and resources to serve the underserved. Do you have an idea, or maybe one of your staff could tell us what is missing or what is leaving, and whether or not we can get back some of those resources?
Yeah, I know there are some specific areas where there are challenges. I believe obstetrics is one of them, but Sue, maybe you could respond to any particular areas that we want to rebuild, or
or other entities, or historically, I mean, there were hospitals closed, and in a sense, we're swimming upstream, solving a problem that has deeper roots than
Yes.
our responsibility. And I'm just curious as to what efforts are being made to return some of those other resources to the community?
Well, we are, I'm aware from a newspaper article I read prior to my arrival here, and I fear I might not get it right, but I believe there were several other hospitals serving Milwaukee going back a decade or so, and they have now shut down, largely for economic reasons. Aurora has not, and based on my view of their investment in the physical plants at Mount Sinai, it doesn't look like it's going to be shut down in the foreseeable future. I don't know what, if anything, we can do to encourage the rebirth of additional hospitals to serve the underserved. But we can and must find other venues for our academic mission and ways in which we can realistically partner to help reestablish access to health care. But most of what we will do will be based on what we do as an academic school. We cannot pretend to be a Department of Public Health. What we are proud to be is a school of medicine and public health. So there are some limitations and some areas of focus of what we can and what we can't do. Is that?
Yeah.
I think as this discussion illustrates, one of the important things that we do for the state of Wisconsin is operate the professional schools. We train the future doctors, the lawyers, the pharmacists, the engineers for this state. We are blessed, I think, in all of our professional schools to have some very, very dedicated students. As Dr. Golden pointed out, the School of Medicine and Public Health are training the next generation of our physicians. And all of you have received today a letter that is signed by 80 of the students in the School of Medicine and Public Health. If there are any of those students here joining us today, would you please stand? We'd like to recognize you. Good. Thank you very much for your interest. And I just wanted you to know that the letter from you and your fellow students has been circulated to all the board members. Okay. Any other questions for Dean Golden? Thank you very much, Dean. I think that your combined report here has satisfied the request that the board made from before you even arrived. Also, I just want to ask you and get a consensus from the board. You would be normally scheduled then to give one of these reports next November, and also you are scheduled to give the report on the partnership in May, I believe. Would you be willing, not that we don't want to see you twice a year, but it might just be a little more efficient if you would agree to combine those reports and give both in May of each year?
I think that makes sense. I'm happy to provide information in whatever way is most desired by the Board of Regents. So just let me know.
Well, if there isn't any objection, I think we would, the invitation then would be that you would give both reports in May of each year rather than 2.
Sounds good.
Good. Thank you very much.
Thank you.
Mr. Chairman, let's turn the meeting over to you.
Thank you, Mr. President. Thank you.
Actually, Chairman, Mr. President.
Just pull it through.
His Holiness.
Whatever he insists.
The next item is let's have a little discipline here. You started.
Right.
The next item is the charter school tutorial, and I will at this time turn it over to Regent Davis, who will chair this.
Thank you, Mr. President. Your Holiness. On occasion. Good morning, everyone.
Good morning.
As promised, we are here to learn through this tutorial the chartering authority, accountability, and processes for the exercise of our responsibilities as the Board of Regents to provide oversight and approval of statutorily authorized chartering authority by UW-Milwaukee and to a much more limited degree UW-Parkside. we have put together a tutorial that we hope will clarify for all of us the role we play as Regents in approving and then monitoring the progress of charter schools at UWM and UW Parkside as permitted by state statute. My part will be to briefly describe the role played by Board of Regents. And then I will be followed by Brian Pankey, who is the Assistant State Superintendent of Public Instruction at DPI, who will present the broader overview of public charter schools in Wisconsin, followed by Bob Catman, Director of the Office of Charter Schools at UW Milwaukee, who will explicate the role played by UW Milwaukee. We will leave plenty of time for questions and answers, and to that degree, because all of us have received materials, I would really urge us to certainly write our questions down for Mr. Catman, but I'm gathering, because of the extensiveness of his presentation, that some of our questions may be covered in his presentation, if you follow me. So I'm not saying don't ask any questions, but just as a general rule, if we can get through the presentation and ask the presenter questions at the conclusion, that would probably work better for us. So, the Board of Regents' role, as set forth in the statutes, is very straightforward. We approve those schools that are authorized by either UW Milwaukee or UW Parkside. UW Milwaukee was given statutory authority to administer public charter schools in 1997. No set number of charter schools to be authorized by UWM was established in the statutes, although I know Dr. Catman, I said Mr. before, so I apologize, Dr. Catman will address UWM's intent for how many schools they plan to authorize in total, given capacity and other issues. UW Parkside received statutory authority to charter one and only one school in the Racine Unified School District in 2001. The Education Committee will consider the contract extension for that school at its December meeting. The statutory language regarding the Board of Regents' role is essentially limited to one sentence, and it reads, quote, the Chancellor of the University of Wisconsin-Milwaukee or the University of Wisconsin-Parkside may not establish or enter into a contract for the establishment of the charter school under this paragraph without the approval of the Board of Regents of the University of Wisconsin system. This is in accordance with Wisconsin Statutes 11840, 2R, D2, otherwise known as 2R. The decision made by the board to approve a charter school is aided by the UW Office of the General Counsel's assurance that the charter school meets the legal requirements established by statute and by the Office of Academic Affairs' determination that the charter school has the potential to provide high-quality education to its students based on an appropriate system of accountability. The renewal of the charter school's contract is based on similar recommendations. The board's role, then, is focused narrowly on approval, but we, of course, feel that our approval comprises a much more significant responsibility to the school children of southeastern Wisconsin served by the charter schools authorized by our institutions. We must be sure, whenever a school comes before us for approval or renewal, that it is successfully meeting its responsibility to educate children. We must be sure that the charter schools we approve are doing well. And over time, we hope that there will be some research that speaks to the broader societal impact in Wisconsin and throughout the country of public charter schools. More specifically, we hope to see research generated at UW Milwaukee using their charter schools as laboratories for innovative pedagogy and student learning. And we hope that the schools we approve can make a difference in closing the achievement gap that we know follows students from pre-kindergarten all the way to the university, assuming they can even gain access. Let me introduce now one of Regent Burmester's colleagues, Brian Pankey, Assistant State Superintendent for Public Instruction. And then once Brian has completed his remarks, we'll open for questions of him and then follow with Dr. Catman. Brian?
Thank you very much. Thank you very much. Thank you very much, Regent Davis, members of the Board of Regents, President Riley. It's a great privilege to be here today and an honor for us to provide the Regents with some information on charter schools. And I just want to say at first, I'd like to introduce another colleague of mine, Bob Solner from the Department of Public Instruction. Bob is the Director of the School Management Services team, who's responsible for the administration of our role in terms of charter schools. And also it's a privilege for me to introduce Sharon Wendt in the back of the room, who's one of our charter school consultants who works directly with charter schools on a day-to-day basis.
I'm going to just refer to my slide presentation, which I believe everyone has, and I think can see on the board here, and kind of go through just perhaps a broad overview, of course, with regards to the state's role, and a little bit in terms of the requirements from the state legal perspective and the state statutes, and then talk a little bit about the specific statutes and procedures that apply to independent charter schools that are authorized by the University of Wisconsin Board of Regents through either UW-Milwaukee or UW-Parkside. So with that, on the second slide of your packet, in terms of the basic question, what is a charter school? The National Association of Charter School Authorizers is essentially put forward, if you will, a sort of a definition, but a broader view of what a charter school is, and that is it's a tuition-free public school. It's created on the basis of a contract or a charter, if you will, between a school and a local school board or other authorizer. And certainly it's a wide variety of state processes and procedures in terms of what, in other states, who else can authorize a charter school in addition to a school board. The charter school has more freedom than a traditional public school in return for a commitment to meet higher standards of accountability. And that's something put forward by the National Association of Charter School Authorizers earlier this year. Also, from our Department of Education in Washington, the United States Department of Education, they identify a charter as establishing each school as a performance contract that details the school's mission, program, goals, students served, their methods of assessment, and ways to measure success. Here in Wisconsin, as Regent Davis mentioned, charter schools were created by state law in 1993, statewide, and then for the authority for the UW Board of Regents in the city of Milwaukee was implemented in 1997. Generally, our Wisconsin statutes outline what a charter school can and cannot do. They specify who can sponsor or authorize a charter school and the requirements that must be followed to do so. Generally, our statutes identify what must be included in a contract between an authorizer and a charter school. They note the conditions that allow an authorizer to revoke a charter school. And they also clarify the legal status of a charter school and its employees. In addition, under Wisconsin law, charter schools are essentially exempt from many of the statutes that apply to public schools under state law. Our statutes that we have for public schools run, there's a couple of chapters specifically, chapters 115 through chapters 121. And the authorization for charter schools, as Regent Davis mentioned, under chapter 11840, essentially states that charter schools are exempt from everything else that's in the state statutes unless they're specifically identified in the charter law. And some of those things that I wanted to mention this morning are, under charter law, Wisconsin law, charter schools must do the following things. They must participate in our state assessment system, and our state exams are grades 3, 4, 8, and 10 under state law. In addition, charter schools must also administer tests under the No Child Left Behind Act at grades 5, 6, and 7 as well. I forgot to mention grade 10 as well for under state law. Our charter schools are also required to have all their teachers be licensed by the Department of Public Instruction. Charter schools in Wisconsin must complete the annual school performance report, particularly those under the auspices of school districts. They count their students for membership in their local education agency. That is to say, this is more for school districts, but charter school pupils in individual school districts are counted by the school district that engaged in the charter. And under state law, our charter schools must be non-sectarian in their programs, admissions, operations, and employment practices. In addition, our charter schools in Wisconsin under state law are required to provide annual audits of their financial and programmatic operations. They are required to be open to all children in the district. Charter schools are prohibited from discrimination. Our charter schools under state law are required to follow all federal and state health and safety requirements, and they may not charge tuition to attend them. From a brief historical perspective, since charter schools were implemented. They were implemented in 1993, and there were a few in the mid-90s that were implemented. But we thought we'd just provide some information for the Regents today to show the number of charter schools in place in Wisconsin and their history and growth. And as you can see, beginning in 1998-99 to the present day, the number of charter schools has increased by over 4 times, if you will, from 40 schools back in 1989, 98-99 to 2006-07. And you can see in terms of the increase in the number of those charter schools authorized by school boards across the state of Wisconsin, which has increased from 38 8 years ago to 170 today. The number of charter schools authorized by the UW-Milwaukee began, as mentioned earlier, by Regent Davis in 2000-2001 with 1 charter school. The UW-Milwaukee currently has charter contracts with 9 charter schools. The City of Milwaukee actually was the first independent authorizer to initiate a charter contract. They did so with 2 of those back in 98-99. They now have 5 today. The UW Parkside, which was a more recent addition to the law, under state law, is only allowed to charter 1 school and has chosen to do so and is now in its 5th year. I would also note that the state law also allows the Milwaukee Area Technical College to also authorize charter schools. To date, the Milwaukee Area Technical College has chosen not to do so. One question that often comes up with regards to charter schools in our state is what we call instrumentality status. And instrumentality status essentially pertains to the status of its employees primarily. And that is to say, if a charter school is an instrumentality of a district, its employees are essentially an employee of that school district. And as you can see, the majority of school districts in the state of Wisconsin, 152 of the 172 charter schools out there, are employees of that school district. State law does allow school districts to make the determination, with certain exceptions for the city or the Milwaukee Public Schools District, to determine whether a charter school is an instrumentality or not. The 15 identified at the bottom there are what we would call independent or non-school board authorizers, which would include the University of Wisconsin, the City of Milwaukee, and potentially the Milwaukee Area Technical College, where we would call them non-instrumentality charter schools. That is to say, the employees of the charter schools that work at them on a daily basis for the UW-Milwaukee, as they've currently implemented them, are not employees of the University of Wisconsin, nor are they employees of the City of Milwaukee. In terms of the independent charter schools, the requirements, there's some specific statutes under the provisions of state law. That independent charter schools authorized by the UW Regents are able to only enroll pupils that live in the Milwaukee Public School District for those charter schools authorized by the UW Milwaukee, and for the Racine Unified School District for the UW Parkside Charter School. Independent charter schools authorized by the Board of Regents are required by state law to notify our department by February 1st of the school year prior to the commencement of their operation. And lastly, the independent charter schools are subject to some No Child Left Behind requirements under federal law as local education agencies, with the UW Milwaukee and the UW Parkside functioning as their authorizers, not the Department of Public Instruction. With regards to the funding of independent charter schools, I first want to say with local school boards, they make the determination of how much they're going to give to the chartering entity, determined by the local school board. It could be any amount in theory. However, for independent charter schools, it was determined by the legislature that there would be a state set amount on a per pupil basis that is increased each year by the percentage increase that the legislature increases public school aids to school districts. This year, independent charter schools received $77,669 per full-time equivalent pupil on behalf of what we've estimated to be almost exactly 5,000 full-time equivalent pupils in the state of Wisconsin. That $76.69 is a figure that moved up by $150 per pupil this year. We write a check directly to the charter school 4 times a year for core payments. How that funding is achieved is perhaps an unusual way of doing business for the state of Wisconsin, and that is done by proportionally reducing the equalization aids received by 425 school districts now in the state of Wisconsin. What happens is we determine the amount of funding dedicated by law to these independent charter schools with UW-Milwaukee, UW-Parkside, and the city. This year, we estimate that figure to be just shy of $40 million when you add up all the figures and such, and then there's also a separate payment that goes to the Racine School District. The legislature's authorized that's part of that, about $1 million of it. That money is then taken from all public school districts. There's a proportional reduction. It's about a 0.8% decrease in the general equalization aids paid to public school districts. That they see that on their school aid form. They show that amount, and those amounts range from less than $100 for one of our smallest districts that receives a very small amount of money to about $5.8 million for the MPS school district this year. Under school district revenue caps, school districts are allowed to make up this reduced aid by putting it on their property tax. And the vast majority of school districts use their property tax to the extent allowed under state law under the revenue cap.
Brian, could I ask, how does that, on the previous slide, how does that $7,669 per full-time equivalent pupil in the independent charters compare to the same figure in the public schools?
It's a little bit, I'll give a complicated answer to be sure. If we just look at general equalization aids, which is the vast majority of the money that we are allowed to administer, it's a very high amount. It's probably in the top 20 in the state of public school districts. Having said that, though, public school districts are also eligible for other aids, such as special education, transportation, the SAGE program, and certain other programs that make that comparison a little bit difficult. But to be sure, from a state perspective, in terms of aid, it is a relatively high figure. Even if I would add in those other figures, it's probably well above the average. Looking at it from a state aid standpoint, surely being mindful that obviously these schools cannot go to the property tax.
Because you know every school district has a different equalization aid, or it's not set now, it depends on what they're looking.
Kevin maybe asked you what the cost is.
Right.
Oh, okay. In terms of the per pupil overall cost for a public school district, we don't have any data yet for this year, to be sure. But if we went back a few years, I think the average cost of educating a pupil when all is said and done in Wisconsin, probably for 2005, 2006, was somewhere in the neighborhood of $10,000 to $10,500 a pupil when I look at a statewide average. Now, having said that, there's some wide variance in Wisconsin of what school districts receive, and that also would include federal aid.
Just a quick question. It goes hand in glove with that. I'm sorry.
That's okay.
But I don't want to lose it. How does that $7,669, for instance, compare to the per pupil cost in Milwaukee for MPS students?
I think the per pupil cost for MPS students would be higher than that. But again, when we look at that, we look at using Milwaukee Public Schools as an example. It's a district that does receive a fairly high amount of federal aid that would be incorporated in that, and also they have property tax authority. So with Milwaukee Public Schools, the overall cost would certainly be higher. I can't immediately think of what that figure was last year, but it would be higher than this figure. Having said that, I should note that independent charter schools are eligible under state law for special education aid if they educate pupils with disabilities. That is one of the specific provisions that the legislature provided for. And they do also receive, if you will, under some circumstances, assistance from MPS for some of the Title I and other program services that they may provide to children who qualify as a low-income pupil, for example. That MPS would provide some services for those kids in those charter schools.
Brian, with $5.8 million was lost to MPS, do they make up the
I believe with the information we have right now for this year that yes, that they are using all of their tax levy authority available to the Milwaukee Public School Districts based on their decisions from 2 weeks ago.
Okay, I'm not going to violate my rules, so Brian, please continue.
I'll wait. And then the last two things we just wanted to touch on, and Regent Davis actually mentioned some of these things, but we thought it important today just to identify that the legislature has put in some different stipulations for different charter schools under the auspices of the Board of Regents. And just to perhaps reiterate a bit, for the UW-Milwaukee, there is no cap on the number of charter schools it may authorize. For Parkside, it does say under state law there's only one. There's no cap on the number of children that may enroll in UW-Milwaukee authorized charter schools, nor for the city of Milwaukee for that event or that purpose either. Under state law, UW-Parkside may only have up to 480 pupils in their charter school. In terms of the grades offered, while most of the charter schools authorized by the UW-Milwaukee are for grades kindergarten through 8, there are a couple of high schools. There's no cap on the grades that may be offered. Under the UW-Parkside, they can only offer grades K through 8 at their school. Under state law, the chancellor of the UW-Parkside is a member of the governing board for the contract that is engaged there. And in terms of a biennial report to the legislature, the UW-Milwaukee is not necessarily required by law to do that, but the UW-Parkside is. And then lastly, just to touch on just a few final points, going back the other way, what charter schools perhaps are not. They are not private schools. They're not the schools some of us have all heard about that participate in the Milwaukee Parental Choice Program that many people are familiar with. Independent charter schools, as they're currently implemented by the university, they are not instrumentalities of a public school district such as MPS. So their employees are not UW employees. Their employees are not Milwaukee Public Schools employees. And in the UW-Parkside case, they are not Racine Unified School District employees. And then lastly, under state law currently, charter schools are not required to provide transportation for the children attending these schools, nor is the Milwaukee Public Schools, nor is the Racine Unified District. So it is, again, a privilege, and I very much appreciate the opportunity to be here, and if there are other questions, we'll certainly seek to answer them, and I may also get Mr. Sullivan. Sure. Thank you.
Just to clarify, Brian, and you did a fabulous job, by the way.
Thank you. Thank you.
So, quick question for you. How many MPS instrumentality and non-instrumentality charters are there? Currently, of that 187. How many are MPS instrumentality and non-instrumentality?
We'll look into Bob here for a moment, but if I remember correctly, Milwaukee Public Schools, I believe, has over 40 total charter schools. The majority of those are instrumentality. The vast majority of that, of the 20 statewide that are non-instrumentality, there are some, I want to say at least 5 to 10 of that 20 statewide that are non-instrumentalities are MPS.
Okay. And then for the schools that are non-independent, that 7,669, or whatever that figure was, is that also allocated within a school district charter as well, or is that only for the independents?
That is only for the independents.
Okay.
That is to say that an individual school district could engage in any number of dollars per pupil that it would give to its charter school.
Okay, great.
I have
Judy and then Jesus.
I have two questions, Brian. One is, in one of the slides when you're talking about what the charter schools are legally required to do, and you talk about the annual audits of the financial and programmatic operation.
Yes.
Is that, does that audit an evaluation on the part of the DPI in any way of the quality of the program? And my second question is, would you give at least some major examples of the restrictions that are not imposed on charter schools that are imposed on other schools?
Okay. I think for your first question, Regent Crane, I may actually defer later on to Mr. or Dr. Catman when he speaks about their reports and their audits. But it is, if you will, comprehensive information that provides some of it being certainly financial and background and what the monies were spent on and what have you. But also, I think Dr. Catman will indicate that they provide information on levels of achievement and some of the things going on.
Do anything with that information? I guess that's my question.
This is really information for the authorizer to provide. But certainly we are able to, we have it, but it doesn't provide us with a specific responsibility.
That's why we're not.
Correct. We do not have, correct.
That's it. And then the other, would you give some of the major examples of the restrictions of?
Well, to be sure, there are certainly a number of guidelines and such and requirements that public schools are required under state law. There are thinking immediately there are the 20 standards in terms of certain things that school districts must do. And I'm not sure if I call this a major restriction because I think we view these as, perhaps some of these are positive things, but public school districts are required to have a reading specialist, for example. A charter school is not. But when I think of, if I would call it a restriction, the biggest one I would say for the differences is that a public school district is under a revenue cap, and that the amount of money that it may raise each year is determined heavily by its enrollment and by the amount of the authorization the state gives to them each year, which is like $250. There is no specific restriction, if you will, on a charter school with regards to that.
A school have to, I'm sure, so I'll pose it as a question. So does a charter school have to
That is correct. Right. And there are certain requirements and course offerings that public schools are required to offer to their children.
They do not have to.
That's correct. Right. That is not a requirement that's been put back in by the legislature that they must have.
The first part, just to clear up with you, did you ask, are they required? And he said yes, or you said they're not required, and he said yes? I missed the long list of art and music and yes. What did you?
He said yes.
Got to put in what charter schools are required standards.
Right. Charter schools are not required to have a reading specialist or to offer a specific set curriculum.
Okay. Okay. So they don't have to have a music or an art teacher?
Correct.
Okay.
Or a librarian.
Or a librarian.
Jesus?
Yes.
Thank you.
Okay.
Thank you, Regent Davis. You mentioned in your opening remarks that by definition the charter schools are in fact performance contracts. And in relation to that definition, how are these charter schools performing academically in relationship to the Milwaukee public school systems, and in particular the UW administered charter schools? How are they performing in relationship to the Milwaukee public school system?
Sure. I think it's fair to say, first of all, when we talk about performance, and there's many ways, obviously, we identify the level of performance for children, and some people use test scores, others may look at graduation rates and other things that all are, just as a note, available on our department's website. I would note that we provide this data where it doesn't hinge on, or impinge on a privacy concern. But I think it's fair to say, and Mr. Catman can certainly speak to this, Dr. Catman in a little bit as well, but I think it's fair to say with regards to MPS that some of the schools authorized by the UW Milwaukee and others perhaps do perhaps better in some people's eyes than children performing in Milwaukee public schools. Some probably perform about the same, and some probably don't perform as well if one looked at individual test scores or graduation dropout to habitual truancy rates and what have you. So I think you have a wide array of levels of performance in the various schools authorized by the Board of Regents.
And I don't know what to do with that answer, Regent Davis, when we say that some of them are not performing as well, some of them are performing the same. Are we interested in getting more specificity on those individual schools?
Well,
I'm not sure that it can all be done today, but I'm certainly interested in the future to be provided with that information.
Well, I think we're a little bit premature because we haven't heard from Dr. Catman relative to the UWM charter schools. So perhaps after his presentation, Jesus, we can revisit the question of whether we need any additional data. Is that fair? Okay. I think Brett next, and then Peggy.
A quick question. Has there ever been a situation where an authorizer has revoked a charter?
Yes.
Repeat that? Has there been a situation where the authorizer has revoked the charter?
Yes. For example, I believe the Milwaukee Public Schools has revoked 2 charters earlier this fall.
Okay.
And I believe the city of Milwaukee has as well.
And there seemed to be, when this was first authorized, a good number that started the first 5 or 6 years. It was up to 130, and now it seems from the graph that there's been some leveling off. Is there a reason, or can you attribute why there's been an initial burst of them, and then there's kind of been a leveling off?
I'm not sure there's a specific answer for that. Perhaps it's, at least on the school board level, you have varying levels of interest from time to time with different school boards. Some have sought to continue to add to charters, number of charter schools. Perhaps some of them have seen that they've achieved already the right level of charter schools in those districts. I think on a statewide basis, of the 172 that have been authorized by school boards, I believe, Bob, the number of school boards is about at 90 to 95. And I think with each year we see more school boards choosing to do that, but perhaps the number of actual charters in a specific district perhaps has leveled off a little bit. But I can't give a specific reason as to why that may be. Right. Right.
Okay, that might have something to do with it.
Thank you.
Welcome.
Discrimination. You had said that they must abide by all the discrimination laws that public schools do. Can you be specific about that? Specifically address the issues I hear a lot about physically handicapped students. And do they have to abide by that?
I think it's fair to say I may defer here to Mr. Solder as well, Regent Rosenzweig, but they are required to provide appropriate services to children that enroll in their schools.
So just to take that one step further, so the physical plant, the building would have to accommodate physically disabled students just as a public school can.
That's correct.
And if the public school can't, then...
Correct.
Okay.
Okay, how about if we have Dr. Catman? But I do want us to, a language thing. Remember, these charter schools are also public schools. Just so that we kind of keep our mind, they are not private schools. Dr. Catman, thank you. Thank you, Brian.
Thank you.
We may have to ask you some more questions a little later, but let's... Okay. I hope not, but... Everybody, you can now refer to your big, handy binders. Am I right, Dr. Kaplan? They can refer to their nice, happy day binders.
Chairman Davis and members of the Education Committee, Regents, it's a pleasure to be here today and have the opportunity to talk to you about the charter school program at UWM. You've asked a lot of interesting questions already, and I was sitting there thinking, gee, I'd like to get involved in this and answer some of those. So let's get started. First of all, understand that the charter authorizing process is extremely important. We don't replace the DPI, and I'd never say we are even close to that, but we serve some of those same functions. We are the monitoring agent of the schools that are chartered. And we have to then make certain that we establish our clear expectations, that we know what those charter schools are doing and what the data says about them, and that we evaluate them and take appropriate action in regard to them. The whole intent of the charter schools can maybe get broken down into 3 words, and that is innovation, agility, and accountability. These schools must have some different pathways to learning. These schools must be able to look especially at the students that they're serving and determine what are the ways that we're going to catch these students and bring them forward. How can we do something different that is going to be meaningful for the students and for their families? Agility means that they have to be very able to move around the community and around the networking for marketing to obtain students for additional funding. One of the things that was asked is on the limit of funding, and that's something very important because many of them are out there raising funds every day. and they are more entrepreneurial in receiving donations usually than the standard public school is. And finally, they need to be able to engage the parents and the community. People don't come to these schools because they're assigned or it's the only school open. They come because somebody in that family wants that child to come there. I mentioned busing earlier. They're not required to bus students. Most of them do. But even then, there's a commitment by the parent because it's their own busing network. So instead of stopping at the multiple stops that the MPS buses stop, sometimes they even have to drive a mile or two to get the child to the bus stop simply because of the affordability of busing. So parents have a commitment, and if they don't want to send the students there, they will do that. And then finally, really, they need to leverage improvement in education. That's what this is all about. It's sort of a grand experiment, in a way, that's taking place all over the country, and we're looking to see if we can set up schools that are more independent, less rule-bound, less structure-bound, to see if they will make a difference in student learning. We've talked about some of the reasons that where we exist and when we started the charter schools, etc. And so I won't talk too much about that. The Office of Charter Schools at UWM is a small office. We're one of the smallest authorizers in the country with our 9 schools. I think Paul Holbrook, who is representing the Racine Charter School, may have the record for 1. Some of the organizations, such as the New Chicago office, intend to sponsor 100 schools in 2 years. Minnesota, on the other hand, is sort of known as the Wild West of authorizing, in that they can have all sorts of different organizations, boys and girls clubs, become an authorizer and be responsible for a school. By contract, we can charge up to 3% of the base state aid that Brian talked about for the schools for the operation of our office. We've never charged 1%. This year it was 0.84. I think next year it may go up to maybe 0.9. But we try to keep these the dollars that we're taking in as low as possible, partly in a personal commitment from me, in that I feel that it's important that every dollar that can be possibly kept at the school, that we try to do that. Our job is really one of cooperating with groups, cooperating individuals who are interested in charter schools, and to look down that road toward the whole idea of how could we help in some way to improve education in the city of Milwaukee. Most of that is done through, I skipped one. Excuse me. Most of it's done through the charter contract, and this really replaces a lot of state law. In other words, we want to address each of these areas to make certain that any school that we authorize has the necessary infrastructure for it to be successful, has the things in place so that students are appropriately taught by teachers who are certified, by individuals who care deeply about them. We want to guarantee that the school will not, and this is important for you, have liability situations that could come back on UWM or the UW system, and yet that they're covering that liability throughout just general operation as any organization would be. Absolutely want to ensure the health and safety of every student that are in these schools. We talked about non-discriminating admissions, maybe a little bit more on that. They must accept any child that walks in the door. And so if that's a physically handicapped child, they have to accept them. If it's a student with a very limited kind of special ed need, they still have to accept them. Now, having said that, in some cases we have not allowed a school to open because they didn't have an elevator and they were not accessible. In other cases, they do have, as any standard school has, the opportunity to move classes around so that the child's needs can be met. In some cases, they can't meet a child's need. And that's true in almost every school district throughout the state of Wisconsin, but then they're still responsible for placing that child someplace where the child's needs can be met at their expense. So just as MPS has centers where a group of children with a special need might have to attend, or in some cases, placing a child at a center like St. Emilian's, which is a private school that serves children with severe emotionally disturbance, our charter schools have that same responsibility.
So do they have to pay for that?
Yes, they have to pay for it themselves. Yes, they do. Now, in all honesty, sometimes parents don't choose to do that if they know that, for example, Shorewood School District offers a program for deaf and blind, and they're looking for a place to move. They're more likely to move where that program is than have a charter school pay to place that child. But if they want to be in that charter school because all the brothers and sisters are there, and the child has a disability, charter school owns them and has to deal with them. We're really looking at a purpose at UWM of, number one, authorizing schools that are innovative, that are unique in their approach to urban students. That's one of the first things that I ask when people come into the office. What would be unique about what you're proposing? How is that going to help education in the city of Milwaukee? Not that it's a good educational plan in Los Angeles or someplace else, but how is it going to help here? We would like eventually to promote the replication of some of the better schools. That's a key idea in education. Of we know, whether it's MPS or any other school district, there are lighthouse schools that are really serving the needs of children. How do we replicate those? We'd like to know that. And certainly we want to promote the continuous improvement of these schools in every way. And we'll talk more about that in just a little bit. In order to do that, excuse me, I've got just a bit of a cold, so I need to accomplish this, we first had to develop the necessary infrastructure. And while we're small, I think we have that infrastructure in place now. We've got some really great people that are working with us, and I think we're able to do the job we need to do. We need to charter a meaningful number of diverse schools. Right now, we feel that number is about 12. And so we're looking at moving up to that mark. And then, very honestly, then comes the sifting and the winnowing at that point, and maybe even earlier than that point for some of those. And we eventually, UWM, not through the Office of Charter Schools, but independent of the office, needs to develop a research capacity to document successes. And I think that's important. The whole program, though, is still evolving. Even though we got underway around the year 2000 as far as chartering of the first school, it's still an evolving program. When you look at our schools, we now have 9, 6 elementary, 2 high schools, 1 K-12 school, which is our largest, almost 1,000 students. The smallest is 44, and is right now on the edge of viability because of that. We serve a high minority population by intent, and I think if you look at where our schools are located, many of them are lined up right along the North Avenue axis in Milwaukee, and they are primarily students that are in poverty. Right now we have right around 3,200 students. But this is where the issue is, and so that's what we need to serve. We're not really interested in starting a gifted and talented school. And there is one case, and that's the Woodland School, that does have a very few, I think it's down to 5 this year, suburban students who were grandfathered by law into that school when it converted from a private school to a charter school. When you look at research, there is some getting underway. John Whitty here at UW-Madison did complete a macro study of charter schools throughout the state of Wisconsin and did do some research in the Milwaukee schools as well. We right now have 3 ongoing research projects that got off the ground this year. And the nice thing is that in regard to that, when you look at research in a regular school, a researcher needs to apply to the school district usually to be allowed to research and to the school, and it's a long process. By contract, our schools are open to UWM researchers, and the schools must cooperate in doing that. For evaluation, and this I think was one of your questions, when I first came into this job, we had started with some evaluative measures, but there was no set defined program. And so the question is, what would really be a robust, challenging accountability system that would push all of these schools toward continuous improvement and allow us to hold them truly accountable? And so what we adopted was the criteria for educational excellence of the Baldrige National Quality Program. This is a business-based model that does have a very strong educational component defined by the, I think it's NIST, the National Institute of Science and Technology, which is an arm of the federal government. But they have Baldrige criteria for aircraft design, they have Baldrige criteria for healthcare, they have Baldrige criteria for different engineering departments, but they have specifically designed this program for education. It looks first at leadership. And I can tell you that leadership is the single most important item in education. If we had an excellent principal in every school in this state, we'd be the very top performing state in the world, probably. It is critical. So we look at not only the leader, but the entire milieu of leadership. They're planning. A school that is poorly planned doesn't go anywhere. Where are they focusing? Are they focusing on the bureaucracy, or are they focusing on the students and the stakeholders? Then we get down to information. We want to know as much as we can about that school. How is their faculty and staff training and focus? Are they really getting the bang for that buck? Process control is so important. We just had one school that's run into process control problems with DPI because they don't have somebody that's facile in the ISIS system. So we need to have people who can do those kind of processes. Most importantly, though, performance results. And they live and die by that, and the performance results address all of those areas as well. When we go into a school to look at evaluation, number one is well-being of the students. If I were to walk into one of the schools and I felt the students were not safe, that school would be up for closing pretty quickly. Academic success, that's what it's all about. Then other areas that are talking about how the school is. When we talk about the audit of physical stability, that comes to my office. We review that. We want to make certain that they have the funding to appropriately carry out their educational mission. We want to make certain that they have accounted for the dollars in a way that was meaningful for the students. We want to make certain that they are using those dollars as much as possible. Overall, they operate with less funds than most public schools in the Milwaukee area. Now, I realize statewide averages are going to bring that down, but when you look at the Milwaukee area, they operate with a lower level of funding. I visit every school monthly, at least. Some schools, one school right now, the one with 44 students, I'm in weekly. And I want to know, what's the school climate? What's the culture? What's it look like? Are the students safe, sound? Are they learning? Are things taking place? What's their focus on improvement? I sit through team meetings such as teacher achievement meetings where the teachers are gathered around to look at the latest data from test results to determine what their next steps are. We'll get into this a little bit more, but school improvement goal progress. Every month we talk about where are you at your school improvement goals that you've identified. What's the key data that's coming out at this time? If they're having process control problems, we review those. And because I'm a former superintendent, I still have some connections, and so I know there's a better process out somewhere. I'll call one of my buddies and say, send me your crisis plan, for example, and bring it and try to get it to the schools. How are they collecting data? And finally, most importantly, are they meeting their contract requirements? Annually, Each school must develop an accountability plan. And an accountability plan starts out with a Baldrige needs assessment by looking at all the criteria in the Baldrige and saying which ones of these are most important for this school at this time to address. That flows into a strategic plan, which then flows into an annual set of goals for improvement. At the end of the year, they must provide me with an accountability report. It goes through all of that information, lays out all the demographics, and lays out all of the student data for student results. We have an ongoing contract compliance record where we keep track of every one of their requirements in the contract because they're there. They have been conducting satisfaction surveys for the first time this year, though we're going to do it so we have the same surveys on every school. They give us formative test results. The test results are taken from different things during the year, and some of the test results, primarily from the WKCE, come to my office as well. And finally, we get all the results from ESEA Title I. And I'm pleased none of our schools have ever been sanctioned by the No Child Left Behind. Had one that was close this year because they reported something wrong. They included the summer months in their attendance ratio when they weren't in school, divided by 300 or 260 days rather than 200 and some days. But and that would be a major flag, and it's part of our contract that says we can non-renew a school. The summative evaluation takes place in their 4th year of operation, or 2 years before the end of an extended contract. Its cumulative nature looks at the previous 3 to 4 years, and it leads to a recommendation to renewal or non-renewal. When we're looking at that, we're following the Baldrige again. We want to know what's their approach to education. How are they deploying it? One of our first evaluations, and the prime reason the school did not get a recommendation for a longer extension, was that they were claiming to have an approach on the use of analysis of test scores, which when we then asked the teachers about, they didn't know about. So we did that double check. Okay, so you claim your benchmark tests are going to tell you all this information, and teachers, what are you getting from your benchmarks? What benchmarks? Oops. That cost them a full year alone just on that evaluation. Data collection, are they really doing a good job there? And finally, most importantly, are they getting results? We have a committee. It's presently composed of 2 people from the community. Mr. Spector used to be a member of that. 2 people from UWM outside of the School of Education, 2 faculty members from the Faculty of Education, and myself who form this committee. We review all the pertinent records. We conduct site visits that include classroom visits and interviews and clarifications. We meet with the board, administration, the teachers, etc. That site visit takes a varying amount of time depending on the size of the school. Some, I mean, if a 44-student school, you could do fairly quickly. The others take a minimum of a day or more. And finally, that makes a recommendation for renewal. The committee has a range. They can come in like for a 5-year extension, like I did for Milwaukee College Prep. They can come in for a period less than that. They can place a school in probation. They can allow the charter to lapse, simply at the end of the 4th year, allow the 5th year to go, and the charter's gone. There's some reasons for doing that, in that property rights of these charter schools have not been well defined in the state of Wisconsin. In other states, they have been partially defined. There have been quite a number of lawsuits when something is terminated. So in some ways, legal advice is often just let them terminate rather than worry about trying to terminate them even earlier, unless they're hurting students, of course. Then you have to take action, and then you would terminate the charter. We're looking here at schools that are independent public schools, but they are public schools. I want to stress that again. They're providing effective research-based instruction, are innovative, work to meet the needs of the students that we feel they have to serve and contribute to the reform in public education. With that said, I'll be happy to answer any questions that I can.
Okay, Eileen, then Jesus, and then Judy. But I also want the board to know that we do have Provost Chang, who's also available. She's actually wearing two hats today. She's wearing Chancellor Provost's hat for purposes of this presentation.
And I would also say that we have Paul Halbert from the Racine Charter School for any questions about that.
Exactly.
And Kirsten Gates, who is our EWM Legal Affairs person, is here also if there's any legal questions that
Okay. We've got a cast of lots of expertise.
That's character.
Okay, Eileen, go ahead.
First, thank you. This has been so helpful to try to understand kind of the history and what is coming forward for Regents, really why they're there. A question I have, last April, it was brought before the, I believe it was a charter school in Milwaukee that was for renewal. It wasn't a new one, it was a renewal, wasn't it?
I thought it was a renewal.
Renewal, but we didn't approve that at that April meeting. So what happened and what's the process? And it looks like you had 9 schools, you still have 9 schools. Was this in your folder?
That was an interesting process. It was a new school that we were asking to have a new contract.
So it wasn't
And it's very complicated. I'm going to be a little careful that I don't tread too far into this. The same organization also operates an MPS school. One of the regents happened to be on the evaluation committee of that school and had some major concerns. The interesting outcome was that it caused me to do, I guess I would have to say, a summative evaluation of the Milwaukee school, which I don't really have any purview to do, but I did. The concerns that the region expressed I did not find, but I found other concerns that did cause me to decide to recommend to my advisory committee, which they supported, not go forward.
Okay.
And I don't want to, I'll talk to you privately about it, but I don't want
I
to
thought it
go
was a
further.
renewal. What if he said no for renewal? Then what happens? What's the process then?
It would depend on the length of the rest of their contract.
Okay.
Probably would mean they would simply run to the end of that contract. Unless, of course, I felt that there was some safety or student issue that had to be addressed.
Thank you. Jesus?
Yes, and I'm looking specifically at page 5, the scope of the evaluation, both the monthly and the annual review. And in reviewing or glancing through these areas of your evaluation and review, is the scope of these reviews, you think, more or less stringent than the DPI standards and such? And what, if they are, what is the distinction between these standards and standards that are based on the DPI conference?
Can I clarify something before, or were you going to?
No, go ahead. You might. You can be doing the same thing. You go ahead.
DPI does not evaluate the charter schools, okay? It depends on who the chartering authority is. So if it's the local school board, which you saw how many of those, then they would be responsible for really the standards. Okay, so I think what, in your case, your question then we would just phrase, are they, in the case of MPS, because MPS does have criteria for their charter schools, they evaluate them, and as you heard, they closed 2 of them this year. And I think maybe, is that what you're kind of getting at?
Right.
Is ours,
Are
yeah.
these criteria that MPS uses in evaluating these charter schools, are they more stringent than DPI standards for regular public schools?
Oh,
That's a different question.
that's a different question.
Well,
That's a good question, too.
It was part of my initial question was answered by the fact that the authorizer is involved in the evaluation of these charter schools rather than DPI.
Yeah, it's both of, that's a very good question.
The best I can answer that, the DPI is really monitoring the state contract with schools. Now, by that I mean we have the 20 standards, we have the different rules on testing, etc. These are all legally based. or rule-based coming out of the legislature. So their job is to follow those and make certain that school districts comply with what's in the law. The charter schools don't have those same laws applying to them in most cases except for certification, which we cooperate on. If they have a certification report that they have to send to DPI, and I'm looking at that usually before they send it in, and certainly afterwards if the DPI finds any problems, I'm there addressing those. But other than that, we move into an evaluative phase that is beyond the purview of legal requirements. DPI has no requirement to look at the school culture, for example. We think it's very important. If there's a culture of learning there, there's a lot of hope for that school. If the culture's not there, there's little hope for it. So we go into things like that. DPI collects data, we collect data. The difference is, though, that I use the data to see, are they performing on their annual improvement goals? Are they performing on their strategic goals? DPI does not get into that kind of process.
I mean, and I congratulate you in going beyond some of the areas that DPI requires public schools to do, but I want to focus primarily on the academic performance. In terms of the criteria and standards that you use that are distinct from DPI. I want to see the results. I initiated my first question as this is a performance conference. How are the students performing academically?
By the way, Regent Davis, there is no data here in terms of the individual schools and how they are performing, and I would like at some time to be able to get that beyond the discussion today.
Some of that was in my initial presentation. I need to tell you, and we cut it out simply because of time, because it does take a long time to do that. And I do bring that to you whenever I ask you to do a renewal. So you get that specifically at that time.
Going back to the
Okay, the best thing I can, and maybe I'm going to answer a slightly different question and phrase it different. How are they doing? And I think Brian answered this a little bit. And the answer is there's a great deal of variability. Understand, though, that they're also in different stages of development. I've had schools that have started out with some severe problems. Actually, before I became the director, the very first school changed leaders, I think, 3 times in the first year. But they were bringing in several hundred students. They were bringing in brand new faculty staff. Everybody has to learn to live together and work together for that to happen. So it takes probably 3 years for a school to really shake out of that process before if they're a brand new school. The 2 that have been the most successful are schools that converted from private schools to charter schools. Why? They have a long history. Woodland School, I think, has been around since 1931, and Milwaukee College Prep had 7 years before they came to us. So they've got some history behind them. Then after that, you still see schools that do it better than other schools, and that's part of the process of winnowing, and that is going to start happening, very honestly, because we're going to be looking at different things. When they're in their first year, 3-year shakeout, okay, you want to see the organization in place. You certainly don't want to see the children harmed in any way, and you want to see them making progress. But I don't think you can expect that all of a sudden they're going to go from nothing to the best school in the city. Some of them that do have some history, like Milwaukee College Prep and Woodlands, are among the very best public schools in the city of Milwaukee. And so we have to follow that. As we go forward, if schools don't make the grade, one of 2 things will happen. They will either be put into a replanning mode to improve, or their charter will be terminated. And that's the one positive thing about charters, is that if they're not working, you can say, let's move these children someplace else, and we'll go from there. But right now, with the exception of, I said, one that is really, really struggling, they've got the organizational background they need. They're starting to make progress in every regard. Some fall a little bit below the average of MTS,
How many sons?
Two.
I
One
think we have
one
to.
struggling, two.
Falling below the average. But understand you have the Lake Wobegon effect, though, because if we said we're going to close those as well right away, you'd have to close half the Milwaukee public schools, too.
Yeah, but these schools are supposed to be better, I mean,
Well-
show improvement
But some of them are only 2 years old, too.
So let's continue.
But I don't want to argue. It's just,
But I do want to follow up to what Jesus has asked. I think that what we would appreciate is some sort of condensed report that says what the performance of the 9 we have are, especially since for every renewal or authorization, you've given that to us anyway, so it's easy to just package it.
I'd be happy to. Be most happy.
Great. Judy?
Dr. Kevin, I'll be brief, and I promise you that I would like to come to visit you and learn more about this, because this is an area of interest to me. And I also need to tell you that I'm an old school board person of one of the larger districts in the state that does not have any charter schools, incidentally, but so I come with some background that maybe gives me some information, but also some biases.
Good.
So I just want to lay that on the table. And I do want to make a point that is of interest and of concern to me, and that is the question of the justification and the reasons why UWM, a public institution, has a role in charter schools. And I realize that they are public schools, so in that sense, that is consistent. But one of the things that seems important to me is that the justification really is improvement of education, which of course we all want. We all want, especially in those places where that is the most challenging, the greatest challenge. And so it seems important to me that this not be that a mini school, that this is a philosophical position, I realize, that it's important that we not end up with a mini school district within a larger school district. We need to make those connections early on, it seems to me. I realize that in the long run there's a research component that then eventually one would hope spreads. But I really think that to improve education in our cities, that I would hope that there would be a lot of interaction between the kinds of the charter schools that would be part of our public institution, UWM, that there would also be a close cross-fertilization with MPS, and with the greater, with DPI as well.
And I fully agree. Let me go back just to the first comment you made. If there is any time that there's a regent who wants to come visit our office, which I have to say is probably the biggest 2-year tables, but you won't see much there. But wants to see one of the charter schools and wants to visit, give me a call. I'll be happy to set up.
It's the philosophy that I'm really interested in.
I mean, but I wanted to just make that invitation. Understand that UWM has no intent. Well, first of all, the reason they exist, the reason UWM is an authorizer is because the state legislature decided they were going to be one. And I'm not sure the politics that occurred that make the decision.
UWM then had to make a decision that
Yes,
this was
and
a role for them.
That predates my time, and I really don't know what occurred there. And don't want to really hazard a guess on that. But UWM has no intent of having a mini school district. Understand, first of all, these are 9 very independent schools, and that's as great as it'll ever be. We do not serve as a central office. The money does not come to us to be distributed to the schools. We do not make policy for these schools. We do not help them with almost anything except for compliance process. They are their own individual school district in a way. And so we have no intent of making this into a competitor of MPS in any way, shape, or form. The schools and our office are more than willing to cooperate with MPS or with the city at any time. And we do exchange data. I talk on a regular basis with the charter people in MPS and their role. We exchange methodologies for how we do things. And so that's there, and it's certainly open.
Let me ask just one other question, and that is, it sounds to me as if then UWM is not making a decision about what kinds of charter schools. In other words, the initiation of each of these schools came from somewhere else.
Correct. The one I didn't...
And why is that? I mean,
because it's this innovation factor. I get a weekly visit from somebody who usually makes an appointment, but comes in and says, I want to start a charter school. And I have this little scenario that says, sort of, are you out of your mind? Because this is really difficult. And it takes an unbelievable amount of work and capacity and cooperation and networking to get a charter school off the ground. Most of the people, we probably get, this year we have 4 prospectuses, and a prospectus is an initial early idea application. So probably out of the 50 people who came to talk to me, 4 of them, after our little discussion, decided to go forward. For next year, you'll see we'll bring 2 of those forward. So we don't bring the idea, but we need to make absolutely certain that the idea is viable, and in most cases, that there is some way that they can financially pull this off. You get 3 or 4 teachers, and they're interested in having their own school, and they have no monetary backing, and they want to start a school. That doesn't happen at UWM. Every school that comes to us has had some way of arranging financial support, usually before. That's why many are connected to organizations such as the YMCA, Milwaukee Center for Independence, Medical College Milwaukee, Urban League, etc. Because without somebody else out there, it's very, very difficult to do it. So we don't want to tell them what the ideas are, because that would defeat the whole purpose of the charter schools. We want them to come to us and say, we think we can do something better for the students in Milwaukee than presently done, or even if it's for a select population of kids. One of them specializes in science. One of them specializes in business and economics. So it's a little bit different nuance. We'll say, okay, is this the book that brings a child into the educational milieu?
Why did he...
Okay, excuse me, Judy. Judy? I've been real patient, honey. I really do need for us, we're already 10 minutes over, and I've been looking this way, and therefore not giving this way an opportunity to ask maybe a brief question. I do want to promise the opportunity for us to look at performance of the UWM charter schools as a follow-up as part of the education committee, and we can talk as a committee about what kind of information and data we'd be interested in. But I really need to start to cut us down in terms of conversation and offer an opportunity to my colleagues at this way.
Okay, we have a couple of questions here. Mine will be brief because I'm not sure you can answer it right here. The request would be a picture, if you would, of the geographic distribution of our UWM charter schools, as well as, and maybe it's here, I just haven't been able to fish it out, a kind of focus on those 9 schools that you have and what their particular scholarly expertise is going to be. So what could we expect from that school? Is it music and arts? Is it literature or science or whatever?
Well,
so I'd like to see kind of within that what their target and focus is. And finally, the scholar, it gets at Regent Crane's question. What is the connection once you've established the school and that it's going to be there? What is the connection, academic and scholarly, with the School of Education or UWM? In other words, do we learn anything? You said, yes, we'd like to replicate, but I'd like to know, do we write papers? Do we have professors who go in and work with it? Just kind of, what is the connection and the outcome that we could expect that would be better?
I'll see if I can do this very quickly.
No, I want to know the answer.
Oh.
This was just a question that we could do.
I'll add that to the academic
real
report.
quick.
That's fine.
After Chris. Okay.
My first question regards to the faculty that we're hiring to teach in our in the charter schools. I think it's important that we have qualified people who are willing to stay and build up the experience. But so that leads me into wondering who negotiates the benefits for the teachers that are going to be in the schools, and how high what is the turnover rate? What is the pay in comparison to public schools, since this is an independent public school? And for instance, in Milwaukee, is there a residency requirement for the teachers of the charter schools?
Okay, starting backwards, no, there's no residency requirement. Two, when they start their initial contract, we insist that they have pay schedules comparable to MPS. Now, having said that, there's a tendency to hire younger teachers, so oftentimes their total pay load is not as high. Turnover-wise, it's fairly high, and it's high for really one reason. They are not allowed to be members of the state teacher retirement system. And so teachers often are there, get experience, and move on to where they can have that benefit. They go through the same rigors of hiring that other school districts go through. And as far as none of them are union at this time, I don't think that anything prevents them from starting one. I'm not sure. So, but that would be up to them to decide to do. It's not something our office would be involved in at all. Ms. Brave?
Very brief. Just so that another point of clarification about the UWM to our charters. If one of those 9 schools is sued, let's say a child gets hurt on the playground, who's liable?
They are.
Who's the they?
That school. And it stops at that school, and that's the
Doesn't go to
organization.
UWM.
One of the things that we spend, and I shouldn't say I spend, my administrative assistant spends a good deal of time on, we take every insurance policy, we make absolutely certain that it's up to date, we make certain that it complies with our legal requirements, we send it to risk management at UWM so that they can evaluate the vendors and make certain they're there.
Okay.
There are stringent statements in the contract and in insurance policies indemnifying UWM and UW system.
Okay. And then the only other thing that I just sort of, maybe this will lead us, I think, into our next discussion about when we visit this again. You remember when Brian put up the definition of what a charter school is, and sort of what the whole philosophy of the charter school movement was that the charter school is an innovative model to stimulate creativity, right, that we can all learn more from. And in that regard, they're given what was described as more freedom in return for meeting higher standards. And I think that one of the issues that I hear that we will have to grapple with as a Board of Regents is indeed, is that what's happening with the 2R charters that we as a UW system look at? Because, and this is not a criticism, but I know that you're very careful about this, Bob, but when you start describing, and you do look at student data, and you say, well, it takes 3 years to get a school started, and we want to give them a chance, but the problem is that the rest of the state looks at this, and they realize that they're losing money, because their school district isn't getting money while you're down there experimenting, and a school can, is probably and may not be measuring up to higher standards. And that, I think, is the dilemma with going outside of it being the local school district being the authorizer. And when I said we brought $17 million of federal money into our state to encourage innovation and creativity through charters, what we've found at the Department of Public Instruction is that the best authorizer is really when, if you're going to do charters, it seems to, unless you want to create a big bureaucracy or office as you've had to, not big, but you know what I'm saying, you have to have a $250,000 budget, right? Unless you want to create that kind of management in an administrative capacity, it's complicated, isn't it, Bob?
It's very complicated.
It's very complicated.
We just got back from the annual meeting of the National Association of Charter School Authorizers. The number one question that everybody was trying to define is how good is good enough?
Yep.
And it's a national question. It's certainly a state question. It's a question for us. We deal with it every day. We're very concerned with it. And my hope is, yes, things take some time. And yes, things are not always clear with charter schools because of the kind of things they are. But I do think that things are shaking out as we go forward, that you are going to see action taken from some schools that aren't performing as well, especially the second go-around. And that you're going to be able to, I hope, to have a better understanding of your role in this whole process.
Okay, I'm going to cut us all off. I think this was a really great first effort in terms of our tutorial, and we'll have many dimensions to discuss at the Education Committee level and perhaps bring back to the board. So I want to thank all of the presenters. I want to thank my colleagues for the questions that they've asked that have been very thoughtful and helped in our learning process. Thank you.
Thank you, Regent Davis. Thank you. Is there a motion to adjourn? I have a motion. Is there a second?
Second.
Motion second. All those in favor signify by saying aye.
Aye.
Opposed?
Exactly.